The most important thing to do when you get a chemical attack in your eyes is to irrigate it. So wash it out with water, with bottled water, put someone under a shower, try and prevent them from rubbing their eye because that can rub the chemical all over the eye and spread it. So that's the immediate treatment, and then the next thing is get them straight to an eye casualty or an accident emergency department, where they can then look at the pH on the surface of the eye and irrigate it to a normal pH. And then it requires investigation as to how much damage is done, and there's lots of different treatments that we do, including multiple eye drops that can reduce the inflammation and the scarring and the healing and promote the healing. But in rare cases we then need to do surgery, and in a much smaller group of patients we need to do stem cell treatments. The most important reason for seeing someone who's had a chemical burn is to make sure that there's nothing there that will persist. And if there's anything that can be done for the healing early on, that's your best opportunity. The longer you leave it and the more scarring that you get, the less likely it is that you'll be able to get away without having surgery. So the earlier we see patients, the better. So on the whole, most chemical burns, if they're managed well early on, will do relatively well without any consequences. In a small group of patients, there will be severer burns and they will need to have monitoring and or treatment over a period of time. And the aim often is to try and get them the eyes to a state where it's not requiring anything to improve their vision significantly. But as I say, in a small number of patients, we then need to have surgical options available.